Okay, so I did my research project on the automatic CPR machines that we've begun to see in some ambulance services around Ontario and around Canada. So on the left here, you can see a few of the different models that we've got. So we've got a Lucas model at the top there, and then at the bottom we've got the head model on the far left, the auto pulse in the middle, and then just a different view of the Lucas on the right side. So these machines have endless benefits when it comes to paramedicine. They do come at a high cost. We'll talk about both of those things a little bit later, but I do believe that these machines should be implemented everywhere that it is possible, because they do have very good benefits when it comes to cardiopulmonary resuscitation. So before we get too far into it, we're just going to talk about the basics of manual CPR before we compare it to the automatic. So you've probably been in a CPR class that looks a little bit like the picture on the right there. And when you're taught CPR, you're taught to check for breathing, check for a pulse on their neck, and then begin compressions if both of those things are absent. So you'll do compressions at 100 to 120 beats per minute, and a breath every 30 compressions, as Heish outlines in his article. You also have a depth of 5 centimeters on adults into the chest, but the depth, the rate, and the ratio of breaths to compressions also varies between pediatrics and infants and neonates, which is anyone younger than 30 days old. So it can become pretty confusing, and especially in high stress situations, become very confusing. So the automatic machines, so typically the normal mortality rate of CPR, if someone needs CPR done, there's an 80 to 90% chance that they're not going to make it. And of the 10 to 20 people who, or 10 to 20, sorry, percent of people who do have a return of circulation, they probably won't have a good neurological outcome, meaning they'll have deficits of some sort just because their brain was deprived of oxygen for too long, as Obermeyer outlines in his article. And while there are many factors that come into play when it comes to cardiac arrests, every single cardiac arrest is different for different reasons, different age, different health of the patient just in general. But some services have seen that they have about 21% more good outcomes using the machine than doing manual CPR, as Malone outlines in her article. She found that the machines prove very, very helpful in cardiac arrests. So some of the benefits, I've got 7 here, but I could list off probably 20. The biggest one that I think is probably the most important one is that compressions are possible during extrication. So extrication is just getting the patient from, like, as you can see on the right, the middle of the forest onto your stretcher to be able to start your compressions. If you're carrying a patient, if you have them like on a board, or as you can see with the helicopter, they're in the air, you can't be doing compressions. You can't be pressing on their chest if they're being carried. That's not safe for the patient. You could drop them, which is then not safe for the rescuers, and just not safe in general. Many people could get hurt doing that. And so that's just not something that paramedics do. But if you can strap on a machine and that's just doing compressions, you can still carry the patient. You can still put them into the helicopters, do all of those things, which can be very huge, especially for some cardiac arrests. 20 minutes away from a 20-minute walk away from the stretcher. Sometimes, like if they're in the middle of nowhere, you just won't have a good surface to be doing compressions on manually until you get to your stretcher, which can be fatal for most of these. The machines also don't fatigue, so it's very, very important when you do compressions that you're doing consistent quality compressions. These machines will always give quality and consistent compressions, and they don't fatigue. So if you are a 30-minute drive away from the hospital, say, or even like 10 minutes of compressions is tiring. Even if you split it between 2 or 3 rescuers, which is probably the maximum amount of people that you're going to have in your truck at any time, it's still very tiring, and by the end of even 10 minutes, but it could be up to 30 minutes, an hour, your compressions just aren't good quality anymore. which can be very fatal for these patients. It also saves space in the back of the truck and frees up more rescuers. So you only will, if you have a machine going on someone's chest, you don't need multiple rescuers in the back of the truck, meaning you have more space to move around, more space to get other treatments going, preserve their airway, give them oxygen, start a line, start meds, get the defibrillation pads on faster, all that kind of stuff is very important. It also saves space in the air ambulance services. Malone Line outlines that also in her article, that the helicopters aren't very big. They don't have too much space, just generally. So only having to have one rescuer and being able to work around the patient and doing all that kind of stuff is very beneficial for them. These machines, Obermeyer talks about how the machines are also sense the heartbeat. So if the heart stops beating, if you do happen to get someone back and their heart starts beating again, you can leave the machine on, and as soon as their heart stops beating, the machine will start doing compressions again to keep it going. And that will probably happen faster than you can even realize that the heart has stopped beating again. And it also makes CPR very possible in MCI situations, or multiple casualty incident situations. So let's say you have 8 people in a huge car crash, and one of them has no pulse and is not breathing, but then 7 of them are alive and talking to you but need your help. You're supposed to give the person who's not breathing and without a pulse a black card, and you come back to them after you've helped all of the other patients. But if you could possibly just strap on one of these machines and start CPR, that's better than doing nothing for these patients, and it could make the world of a difference when it comes to these patients and having a good outcome. You could potentially have good outcomes from a multiple casualty incident. So to conclude, these machines are priced at about $17,000, and that does obviously differ between the different models and where you get them and all that kind of stuff. But $17,000 compared to all the good support and the benefits that they give in cardiac arrest cases, I believe that they should be used in as many services as possible. And $17,000 when it comes to medical equipment is not impossible. And any service that can afford them and any truck that can afford them should have them on board, because they can help save so many more lives. And these are all my references. The top few are for my photos, and the bottom ones are for my articles. Thank you.